Welcome to Triage Orientation for the general public. Today we are going to explain to you how the triage process works in the emergency room.
It is important to understand what triage is all about, why do we have it, and what can you do to make the process easier and faster. Hi, I'm Dr. Kilroy. Today me and Nurse Ratchet are going to talk about triage.
Hi, I am Nurse Ratchet. I will explain some basics about triage. My job is to sort and to prioritize patients into an order that they are to be treated and to start the treatment process.
The nurse is going to ask some basic questions about why you are here.
I do not want to know what color shirt you were wearing last week. I do not care about your friend's bad night last night. Please do not waste my time telling me about that time 30 years ago in 3rd grade when Billy flung a boogagoer on you.
It is important to get to the point. Please do not waste time by talking on your cell phone trying to make dinner reservation tonight while you are coming into the emergency department for nausea and vomiting that you have had for the last 6 months.
You need to have your list of medications ready for me when you see me. I do not have time for you to dig around in every nook and cranny on your body looking for your list. If you did not bring your list or do not know your medications, then you need to leave and go make a list. Then come back with it. I am not going to call your doctor up north and ask him, and I do not have you in my computer system. I do not have time to wait for you to run to the car, or for you to call a friend at home.
We use a pain scale in the ER to rate your pain. The scale is from 0, no pain, to 10, the most pain you can imagine. If you give the nurse a number that is higher than 10, then you obviously do not understand the pain scale. If you rate your pain as a 10, and can still talk on your phone, or send a text message, then you do not understand the pain scale. Nobody cares if you have a high pain tolerance. What does that mean to me anyway? Do you want stronger drugs? Or do you not need any drugs, because you can tolerate a lot of pain without medications? And, just because you say your pain is at 10, that doesn't mean you will see the doctor any faster. And if you laugh at me, after you tell me that your pain is at 10, then I will not believe you.
When you come to the emergency room by way of ambulance, you can still be sent to the waiting room. It does not mean you will be seen any faster. It only means that you are now going to have to pay a $650 taxi ride to the ER while letting some EMT trainee practice sticking an IV in your lousy veins that nobody can ever hit anyway. And just because you signed in before the guy behind you doesn't mean you are going to be seen before he is.
The triage nurse does not need the 10 family members or friends that came with you to the ER to come into the triage room with you. They talk too much, ask stupid questions, laugh and talk on the phone. This is not a hangout either, so tell them to go home, and you can call them later when you need a ride.
You do not have a special set of vital signs either. If your temperature is 98.6, that means that your temperature is normal. It is not high for you and you do not have a fever. You just do not know how to take a temperature the right way. And your blood pressure is not high for you at 120/70. Nor is it low for you at 120/70. No doctor is going to jump through special hoops for you because your blood pressure is 122/72 or your temperature is 98.8 because you feel that they are outside your normal range.
That's right, Nurse Ratchet. I'm not going to do anything for your normal vitals, even if they are not normal for you.
Please do not tell me you do not have any medical problems or history when you take 10 different medications and are covered with scars, with a list of allergies a mile long. If you take medications for hypertension and it is because you have high blood pressure, don't tell me you don't have a history of high blood pressure.
The most important thing to remember when you come to the ER and are going through the triage process is that a lack of planning on your part does not constitute an emergency on our part. Be patient, be prepared, be direct and to the point.
Do not drive yourself to the ER and park your car in the parking garage, then walk to the entrance, passing 15 wheelchairs, then decide you are going to lay down in the floor and start yelling for help. You are capable of walking the next 15 feet to a chair, or you should have gotten in a wheelchair as you are walking to the ER. This type of attention-seeking behavior will only delay your care. I understand you may be bipolar, but you don't have to act like it.
Here in the ER we have clocks on all the walls. We are capable of telling time. And, just because you come in at lunchtime does not mean we are going to feed you, especially when you have been vomiting for the last 2 days. I don't care if your wife or husband is a diabetic and need to eat. They can leave and go get something. It is not our responsibility to feed your family or babysit your children, and we do not have diapers or bottles for your baby.
I hope that this has helped prepare you for your next visit to the ER. Remember to be nice to the staff and they will be nice to you. If you act like an ass and sound like an ass, then you must be an ass. So do not be an ass. It will only make things worse. Thank you for watching. I am Nurse Ratchet.
Let me leave you with one last bit of knowledge. It is a third-degree felony to hit or spit on any EMS worker or ER staff. Thank you for watching. I'm Dr. Kilroy. Goodbye.